Asenapine. It is a near-atypical antipsychotic, and the chemical structure is related to the antidepressant mirtazapine, and thus share several of its pharmacological properties, especially 5-HT2A, 2C, H1 and alpha-1 antagonism. Of course, suggesting that asenapine would be an antipsychotic with antidepressant actions. But only its antipsychotic and antimanic actions have been proven thus far. It is unusual in that it is given as a sublingual formulation, because the active drug is very poorly bioavailable if it's swallowed, due to extensive first-pass metabolism, and this limits the size of dose and the extent of absorption at high doses. Therefore, it is generally given twice a day despite a long half-life. Can be used as a rapidly acting oral antipsychotic as a top-up in some disturbed patients, without restoring to injectables. One side effect of sublingual administration in some patients is oral hypoesthesia. Can be sedating, especially upon first dosing, but does not have a high propensity either for EPS or for weight gain or dyslipidemia. Its antagonistic actions at 5-HT2C, 7, 1BD and alpha-2 receptors, and partial agonist actions at 5-HT1A receptors. As studied previously, serotonin inputs to 5-HT2C receptors on GABA interneurons, both in the brainstem and in the prefrontal cortex, normally causes GABA release onto norepinephrine and dopamine neurons, which in turn inhibits the release of norepinephrine and dopamine out of these neurons in prefrontal cortex. When these 2C receptors are blocked, norepinephrine and dopamine release is disinhibited in prefrontal cortex, which theoretically has antidepressant effects. Antidepressants such as agomelatine and mirtazapine and others that have 5-HT2C antagonistic properties that are predicted to raise norepinephrine, serotonin and dopamine levels via alpha-2 antagonism also potentiate the elevation of serotonin levels in the presence of certain reuptake blockade by SSRIs or SNRIs via 5-HT1BD as well as 5-HT7 antagonism. These properties suggest utility for negative symptoms of SCIS.